Hello and welcome. It's Jessica Drummond from the Integrative Women's Health Institute. Today, we will be learning the 7 steps to relieving chronic pelvic pain. This webinar is for professionals to introduce you to a holistic and integrative approach to working with women who struggle with chronic pelvic pain conditions. So let's jump right in. We all know that healing chronic pelvic pain can be a challenge. As a clinician, it can be one of the most frustrating conditions to treat. You have tools in your toolbox right now: physical therapy, medication, pharmaceutical drugs, surgery, depending on your practice. There are all these tools that you might be aware of. But I want to share a new approach. And this approach does not have to be distinct from the other approaches. It can also often be in collaboration with the other approaches. So, what is functional nutrition? Functional nutrition is the use of food and vitamin, mineral, and herbal supplements to address root cause loss of optimal function of certain physiologic systems, of any physiologic systems, including the digestive system, immune system, urogenital system, neurologic system, endocrine system, and the microbiota. Those are the key systems that are addressed in chronic pelvic pain. It is also the empowerment of each patient or client to own her healing journey and nourish herself beyond just the biochemical and physiologic. It's a focus on community support, pleasure, restoration, mindfulness, connection with nature, personal and professional development, and biopsychosocial pain reduction strategies. So, how does this perspective help women and men with chronic pelvic pain? Well, because the pelvic pain is a unique physiologic bowl that houses the reproductive system, the bladder, the gastrointestinal system, and musculoskeletal system, and it's often the physical location where clients can hold fear, anger, specifically sensations around lack of safety in their body, lack of safety in their lives, or other emotions. It's a unique area of the body where a holistic approach to helping the client to optimize her biologic, emotional life and community health is essential. So this larger perspective, this more holistic perspective, encompasses all of these things. Every chronic pain patient's healing, quote unquote, recipe is unique. So we have to consider trauma, stress. What is her perspective on her healing? Is she highly optimistic? Is she skeptical? Is she pessimistic? Nutrition and physical medicine are 2 key components: immune health, digestive health, endocrine health, nervous system plasticity versus nervous system degeneration, neurodegeneration, surgery, and medication. So any given patient may need to focus more or less on all of these different components of the healing recipe to find her individual healing recipe. So step 1, history and mindset. What is your patient's pain story? Has anyone along the way had the mindful listening and coaching skills to fully hear her, give her a safe space to share her story and really take it in without distractions? Has she had the opportunity to discover if any of her past trauma or current stress is impacting her pain? Does she understand pain science? Sometimes simply giving some pain science education helps to soothe the fear around pain. Step 2 is nutrition. So we start with an elimination diet as an assessment tool to find her optimal nutrition plan. Genetic testing can also be helpful, and the software programs are improving quite significantly, which are helping us to increasingly fine-tune diet based on this massive amount of data we can get when we look at a person's genetics in the context of all of the clinical published research around data around nutrition and genetics. Blood sugar balance is essential for hormone balance. Mindful eating. So is she eating under stress or with relaxation, with people she likes? Is she chewing her food thoroughly? One of my colleagues posted something recently that said something like, chew your food. Your stomach does not have teeth, right? And it's so simple, but so important when we're trying to give women healing diets that don't irritate the immune system or hyper trigger the immune system. And eating with pleasure. One of the most important things that I've noticed in my practice and working with women with chronic pelvic pain is when they begin to focus on, even in the midst of a really awful pain journey, they are able to find moments, experiences, people that enhance their pleasure. It's so healing. Step 3, digestive function. So supplementation to support things like hypochlorhydria, lack of digestive enzymes, which is extremely common in my practice with essentially every client over 35. Intestinal lining integrity, so quote unquote healing, increased intestinal permeability or a leaking gut, micronutrient deficiencies, and looking at gut and vaginal microbial balance. So looking at the microflora, the microbiome. Step 4, having a healthy pelvic structure, movement, and pelvic floor strength and relaxation. A thorough physical therapy assessment by a skilled specialist pelvic floor physical therapist is essential. In some cases, appropriate sexological body work and or energy work, depending on the patient's perspective, depending on the resources we have available for skilled, ethical people doing that work. But in some cases in my practice, I've seen wonderful, essential breakthroughs happen that weren't able to happen in a more clinical pelvic floor physical therapy setting. Step 5, nervous system downtraining and adaptive plasticity. So at the end of the day, the nervous system decides whether or not there will be a pain experience. And thus, we want the nervous system flourishing at the cellular level so it becomes less sensitive to signals that could become a pain experience. So pelvic floor, this will include strengthening or making more resilient the nervous system overall and at the cellular level by using things like pelvic floor muscle relaxation exercise, therapeutic yoga and breath work, mindfulness and meditation, laughter, cognitive behavioral therapy with a pelvic pain specialist psychotherapist, anti-inflammatory foods, increasing flavonoids in the diet or supplementation, omega-3 fatty acid supplementation or dietarily, leptin balance, mitochondrial support, and hydration. And step 6 focuses on endocrine health. So healthy stress hormones and insulin levels, healthy circadian rhythms, appropriate testing for sex hormones, stress hormones, thyroid hormones, regular menstrual cycles with minimal symptoms, nutrition, supplements, and lifestyle to restore sex hormone balance. Circadian rhythm, I think, is the number one issue in this category that I see day in and day out. With our excessive exposure to screens and blue light devices, women are just crazy busy. And so they're staying up really late. They're not sleeping well. That makes a huge impact on hormonal health and balance. And finally, in step 7, we have to be sure that each client has a personalized patient-led multidisciplinary team, both a professional team and a home team. So these teams of supportive people have supportive skills and they can offer emotional support, everything from excision surgery and medical management to childcare and meal preparation. And, a lot of these things are equally as important. We give a lot of weight to things like excision surgery, and that is very important. But if your client has an excision surgery and post-op goes home as a single mother to taking care of 4 kids, her outcome isn't going to be nearly as good as if she has community support around childcare, meal planning, meal preparation, emotional support. All of these things really carry equal weight, and certainly different things are more important than others in each individual woman's practical situation. And health coaching to give patients the tools to develop their intuitive muscle for decision making. Every woman with chronic pelvic pain should have a health coach on her team to really help her navigate her healing journey and to find the professionals that resonate most with her and to build that supportive home team for all of the practical aspects and for emotional support. So in the program that I teach, Functional Nutrition for Chronic Pelvic Pain for Professionals, this professional training, we're flipping the conventional approach of addressing symptoms with pain management tools upside down. And instead, we're focusing on optimizing the health of all the systems that impact pelvic health: the physiologic systems, the emotional systems, and the community support networks. This is all based on my experience that when a woman's or man's resilience and empowerment are improved, their symptoms are naturally reduced or relieved. So at the bottom line, this is a root cause resolution approach. It takes longer, and we've got to assess and optimize the functioning of all of these different systems: the digestive system, the immune system, the nervous system, the endocrine system, the musculoskeletal system, the emotions, her emotional support network, and the community that she's living in, both her healing team and her neighborhood, her friends, her family, because all of these pieces of the puzzle play such an important role. And certainly in each individual client, some of these play more important of a role than others, but we have to take the time to look at this from such a wide angle. And over time, what that does is really helps the client or patient to step in and own her own healing journey. So let me illustrate this with a case study. So I had a patient, she was 29 years old. She struggled with painful sex. So she came in. I don't have a physical office, but we work together virtually, and I created a safe space, spent a lot of time mindfully listening for her history. She had over time made some improvements, but plateaued at a level of a sort of consistent, modest pain, 6 to 7 out of 10. She was, reduced from 10 or 11, or she was in really intense pain using physical therapy, but she still had this like chronic pain. Maybe it wasn't 6 to 7, it was more like 4 to 5 all the time. And then it was worse with sex. She had pelvic floor muscle tightness, and she was uncomfortable using dilators. She had painful sex for 6 years. She felt better on vacation, but that didn't improve her pain with sex. It improved her general resting level of pain, but she still had painful sex. She works as a part-time copywriter, no children, complained of always being tired. She reported having unbalanced hormones and irregular periods starting at age 12. And she had an endometriosis diagnosis in her teens. She started on the NuvaRing and experienced significant weight gain. She had regular massage therapy, which again was helpful for lowering that chronic level of pain, but it didn't resolve her sexual pain. Then she had laparoscopic surgery for endometriosis about 5 years ago. Vaginal dryness that was improving, but still a problem during sex. Intermittent bladder and urethral pain. She stopped birth control. That didn't resolve her symptoms. Her migraines improved with some dietary changes. So then we made some recommendations for that first step of really listening to her story, mindful listening, and knowing what does she need for a level of mindset support. Well, I referred her to a pelvic pain specialist psychotherapist to help with her marriage, and I instructed her to read pain science based in Butler and Mosley's work. Step 2, nutrition. She was eating a vegan diet, very clean and anti-inflammatory, and she was seed cycling, which doesn't have a lot of evidence in the literature. I don't see it as being as very effective clinically, but some women do report anecdotally that it's helpful. I recommended food journaling and found that her energy was decreasing, and she continued to reduce her intake because she was feeling very restricted about what she could eat. So she was only eating about 1,500 calories per day. So we really had to amp that up, right? Let's increase her vegetable intake, added a little bit of fish, which she was open to. more healthy fats, nuts, seeds, coconut milk, organic pea protein powder supplements to smoothies to add more nutrient-dense anti-inflammatory calories. Then we took a look at her digestive function. She reported slow digestion and 3 out of 10 abdominal pain after eating. On organic acids test, she showed signs of intestinal dysbiosis, but no yeast overgrowth. So lots of chewing, mindful eating. The evidence-based number of times it takes to chew something hard like an almond, 40 times per almond. You know, you're not going to overeat almonds if you turn each of them 40 times, right? We added digestive enzymes, glutamine for her intestinal permeability, which you can measure on a lactulose mannitol test, demulcent herbs, zinc, also for intestinal permeability, bone broth. She was vegan, but she was willing to have, she shifted a bit away from vegan over the course of her treatment, adding some bone broth. But if your client is strictly vegan, high mineral vegetable broth is helpful. It's not going to have the glutamine, but it will be high in minerals, which also helps with intestinal permeability. Step 4, she was already seeing a pelvic floor physical therapist, but that therapist added some home manual therapy, and she explored more energetic work with a yoga therapist and by reading Wild Feminine by physical therapist Tammy Lynn Kent. Step 5, nervous system downtraining and adaptive neuroplasticity support. So in her case, she needed mitochondrial supplement support. She was very fatigued. Her organic acids testing showed low fatty acid metabolism, high markers, but low functioning of the citric acid cycle, so low energy, oxidative stress, poor detoxification. So we added CoQ10, L-carnitine, and also some antioxidant support. Additional general antioxidant support in terms of nutrition, eat a rainbow, focus on optimization of bringing in nutrients. In patients like this, I also sometimes add things like alpha lipoic acid or liposomal glutathione. That can be great if it's indicated. Yoga, 4-7-8 breathing. We have some breathing and yoga exercises on video that are very simple. Daily mindfulness meditation practice for 10 minutes. We also have guided meditations on audio and video for our clients, and we often collaborate with local yoga therapists, yoga instructors, physical therapists who are trained in yoga as well. Endocrine health, low overall diurnal cortisol. She had a 2 p.m. high cortisol spike, so she was getting a little antsy in the afternoons. Low progesterone, normal thyroid hormones, normal sex hormone binding globulin, normal estrogen, testosterone, and DHEA. So we're working more on stress, circadian rhythms, and increasing her progesterone levels. So to normalize the cortisol, health coaching and referral for cognitive behavioral therapy, sleep and circadian rhythms were addressed with that getting off the excessive blue light exposure. Lots of sleep strategies. To increase progesterone, I add vitamin C supplements, vitamin C foods, and in this case, I also added Chase Tree Vitex, which is a great supplement for increasing progesterone for women who have shortened cycles, difficulty sleeping, things like that. And she had to eliminate caffeine and alcohol, which wasn't fun, but she was willing to do. Step 7, we looked at her patient-led multidisciplinary team. She no longer was working with a surgeon, but she did continue with her pelvic floor physical therapist and psychotherapist. We were working to find a local integrative gynecologist, and she continued health coaching with one of our health coach team and looked at what we use as a document called the Web of Support to build her home team, the childcare support, house cleaning, who can, be her backup on days when she's not feeling well for any given thing. What's her flexibility at work? Who is there for emotional support? Maybe you have some friends who are great to be around when you just need a good laugh. Others you're willing to just vent to, tell your more sad stories, and they hold space comfortably. Finding these people and figuring out who fits where, having some depth to the home team. So it's not just one person you're always calling for backup childcare, but a whole list really gives women a feeling of safety and support. Over the course of 6 months, this patient's pain was fully resolved, except for occasional and mild flares when she felt increased tension and less safety in her marriage, when she went to a family celebration and ate gluten and high sugar birthday cake, and when she was under stress and she had let go of her sleep and mindfulness practices. But she knew her own recipe for pain modulation. And when you can modulate your pain by going back to your recipe, that's so empowering for the client. Even if going back to the recipe means you check in with a professional, you go see your pelvic floor physical therapist more often that week, you go back and check in with your nutritionist and get some new recipes when you're craving something but can't have birthday cake, it's all part of the experience to work with professionals. So it's not that the patient has to take ownership of everything, but they are the leader. That's very empowering. These flares were mild, and she was able to return to pain-free sex when she, as I said, returned to her personal pain relief recipe. Having clients understand that is so empowering for them. So for you to learn this as a women's health professional, whether you're a health coach, physical therapist, physician, nutritionist, fitness professional who works with women with pelvic pain, we have a program called Functional Nutrition for Chronic Pelvic Pain. This program, as I said, is for professionals. I teach it. There are 8 online modules which are delivered to you weekly, although you can take as long as you want to get through them. We have live Q&A calls every other month for lifetime. You can participate as long as you want. Extended support in our Facebook community where, again, you can participate for as long as you want. We don't kick you out after 8 weeks. CEUs are available for a number of professions in a number of states or countries, so ask us about your particular CEU needs. And we do offer an exam at the end of the course and a certificate of completion. So what the program contains is we start out with an introduction to a deeper understanding of what functional nutrition really is. I touched on it today. We'll go really deep. And I'm giving you a clinician experience. I believe that functional nutrition is best experienced personally. Now you can do this to your level of comfort, as much or as little as you would like. But the more you begin to turn the mirror on yourself and start taking great care of yourself in a supportive, professionals-only community where all of us are on the path, right? And supportive of wherever you are on the path, it's very motivating, and you become so much more of an inspiration to your clients. We also cover optimizing gut, intestinal, and vaginal microbiota balance to minimize pain. We talk about digestive issues, including constipation, IBS, inflammatory bowel disease, and irritable bowel syndrome. These are significant contributors, even if your client's main source of chronic pain, the root cause, is actually in the bladder or the reproductive or musculoskeletal systems, still need to optimize digestive health because of organ crosstalk, as you know. Optimizing immune health and reducing chronic inflammation. We talk about the pelvic pain elimination diet and how to implement it in your practice. We discuss genetics, and that is exploding in terms of research and understanding. Genetics, epigenetics, potential impacts on chronic pelvic pain of a client's genetics, nutrients, neurotransmitters, the nervous system. So we use mind-body nutrition to support quieting of the pain response. We talk about how to optimize adrenal, thyroid, and sex hormone levels naturally to support pelvic health. And if the natural strategies aren't enough, how to find a highly skilled and effective physician who can work with hormone replacement therapies effectively and safely. Optimizing the detoxification system to support pelvic health, health coaching strategies to empower women in pain. So how does this work? Well, this program is designed for busy professionals. We have found the online format to be most effective and honestly most in demand from our student population. We have students taking this course from over 30 countries in a variety of health and wellness disciplines, so you will be in good company. You'll receive 8 modules of material, 1 module per week in a private membership site. You'll meet others in the program from all over the world and across disciplines in our private Facebook group, and we will have 1 live Q&A session every other month. You'll get the schedule when you register, and if you can't be there live, you can always submit your question and then listen to the recording. Am I qualified to teach you this? I hope so. Have been in the past 5 years an invited speaker at top conferences for pelvic health professionals, at the American Physical Therapy Association Combined Sections meeting. In fact, I first taught there like maybe 13 years ago. We won't get into that. This is starting to show my age. International Pelvic Pain Society clinics and conferences in Ireland, California, New Jersey, Texas, New York. I'm actually going to London next week. I've been invited to speak in Turkey early next year. So, hopefully that will vouch for my expertise. I've been an invited guest on major podcasts, including the Pelvic Messenger, Couch Talk with Dr. Anna Kabecka, The Future of Healing, the Healing Pain Summit, and so many more summits. I literally just got off a summit interview today, and I can't remember the name. It was like the Integrative Women's Health Summit, something like that. So these are happening all the time, and I am generally invited as a guest to speak on this topic. I have a master's degree in physical therapy from Emory University in Atlanta. I have over 12 years, it's more now, 15 years of pelvic physical therapy experience. 5 years running an integrative practice in functional nutrition and coaching for pelvic pain and other women's health concerns. I'm a doctoral student in functional nutrition. I'm actually the first class ever designed of a doctoral program in functional nutrition. I'm the author of the Functional Nutrition for Pelvic Health chapter in the Healing and Urology textbook for professionals. So enough about me. Hopefully I've convinced you I'm qualified to teach you this. So I want you to understand what this course will do for you. You can apply this material immediately. Everything that you will learn, you can bring to your practice immediately to build on what you're already doing to get even better results for your patients and clients in this population. And as I said, you can start using this work for yourself. We've had so many professional students come in and get themselves healthier, resolve pain, get pregnant, have easier postpartum recoveries. So much can happen for you in this program as well. So you can be your first case study. And you will likely find the perspective shifts that you'll have as you shift from the goal of symptom reduction, or, we were trained in our graduate programs often with the responsibility to fix the patient. You will have a really important perspective shift in this program. You will be supporting the optimization of your client's health, and this will actually reduce your stress, your overwhelm, burnout, compassion fatigue with even the most complex clients. I'm going to give you some very important health coaching communication tools and just a perspective that will change how you approach this population of patients so they get better results and you have less stress on you. So thank you so much for joining me today. We covered the 7 steps to relieving chronic pelvic pain from an integrative approach that you can use right away in your practice. I hope you gained at least 1 or 2 clinical pearls. You can say, oh, interesting. I'm going to learn more about that. I'm going to try that. And if you want to go deeper with this material, work with more women with chronic pelvic pain with even more success, and have support along the way, I invite you to join us in the Functional Nutrition for Chronic Pelvic Pain program. As soon as you register, you'll receive immediate access to your materials and an invitation to our private Facebook group. You'll also have access to our amazing support team who are there for any tech support or other questions. We are very experienced with technical newbies. You will not be overwhelmed. And if you are, we are here to support you. Thanks so much for coming today. It was my pleasure to share this important information with you. I look forward to getting to know you better and to support you to grow your practice, helping more women to overcome chronic pelvic pain and restore their overall health. The truth is that I started teaching clients almost as soon as I started teaching professionals, almost as soon as I started applying this work with patients, like within the first year and a half. Because I found it so powerful, and I realized that so many more clinicians need to understand this for us to be able to reach all of the women in pain. There are tens of millions of women, probably more than that, around the world struggling with chronic pelvic pain. And I certainly cannot see all of those women in my small practice. So it has been my life's work to work with professionals so that we can reach women. One of the most kind of tear jerking parts of my career, one of the most wonderful and most touching and most humbling things that has happened to me so far is when I got an email from a practitioner in Romania who said, look, I am the only person doing anything like this in my country. I'm working with one gynecologist and we've taken your information. I'm so excited to learn even more and deepen it. And they now, they're helping women in a place that did not have access to this at all. She started with us, I think about 2.5, 3 years ago. So, it's humbling for me. And so no matter where your practice is, whether you're in a big city with a number of other practitioners, you're in a rural community with no other practitioners, you're in a country who has very little healthcare access, there are women in your community who need you to have these skills. And so that's why I'm offering them to you. That's why I'm offering to you at a big discount right now, because I just want this work in the hands of more professionals. So for more information about this program, continue to read on below. The page below, we explain everything. And if you have any questions, email my team and we'll talk with you. All right. Have a great day. Great seeing you here. And I hope that you've learned a few things you can take right now into your practice. See you soon. Bye-bye.